Now very quickly we're going to talk about essential thrombocytosis. This is again a JAK2 kinase mutation, or in the gene that codifies for this kinase. This presents as massive increase in the megakaryocytes, so many or increase in platelets. This can lead to thrombosis and also to bleeding, because if we are consuming a lot of platelets in doing the thrombi, then we could not have platelets in the moment of bleeding. So thrombosis and bleeding. The most common cause of death could be thrombosis. Usually the platelets are above 1 million, about 10 to the 6 cell platelets per cubic millimeter. And the patient sometimes can have erythromyalgia. Erythromyalgia is red, painful hands. Now the treatment is, if the patient has less than 1.5 times 10 to the 6 platelets per cubic millimeter, that is less than 1.5 million of platelets, it is asymptomatic, then no treatment. And so let me say it again. If it is less than 1.5 times 10 to the 6 millimeter per cubic millimeter platelets, or asymptomatic and less than 60 years old, no treatment. If it is greater than 60 years old or has symptoms, for example, thrombosis, or platelets above 1.5 times 10 to the 6 per cubed millimeter, treatment. The best initial treatment is hydroxyurea. This decreases the platelet count. Now, if hydroxyurea produces suppression of red blood cells, then we give anaherilide. The use of this medication is limited due to severe adverse effect. And for prevention of thrombosis, we give aspirin. It would not be very effective. Sometimes it depends if the patient is already taking aspirin, for example, in order to avoid a myocardial infarction. That would be right. And erythromyalgia is also treated with aspirin. So essential thrombocytosis is massive production of platelets. Remember, because this is a myeloproliferative disease, we will also have increase in white blood cells and red blood cells, but the main effect would be in the platelets. Present with thrombosis, treatment, if it is less than 60 years old and asymptomatic, or less than 1.5 platelets per cubed millimeter, no treatment. If has symptoms greater than 60 years age, or above 1.5 million platelets per cubed millimeter, treat with hydroxyurea if suppression with anaherilide.